Alright guys, girls, it was jerninghgam here. In my video I was doing this with my beard in the background because I was just eating something and I was just doing this, itching it. So anyway, apart from me itching my beard, we're going to be talking about the coronavirus vaccine things, and they're not out yet, they're still testing them. And we're going to see what this woman says on the news channel.
Into millions of arms this winter. Pat Hancock told MPs that the new coronavirus vaccine could be rolled out from the beginning of December. But there are some serious barriers to the smooth delivery of doses to millions of people, as our science correspondent Thomas Moore reports.
Lives depend on the new COVID vaccine, but for it to work, it needs to be kept at -80. The moment it leaves the cryo-freezer at Pfizer's manufacturing plant in Belgium, it's packed in dry ice and sent to clinics in a super-insulated box. It's so cold that it's beyond the existing frozen supply chain for other medical products.
The key thing in this supply chain is the amount of product we're talking about and the speed at which we would want to move it. That is an unprecedented challenge. The difference between it being at temperature and not being at temperature is it supports the medicine working or not working. It's as simple as that.
Dry ice is frozen carbon dioxide. Its natural temperature is -80 degrees. It's by chance that this is the low-tech solution to moving around the world such a high-tech vaccine. Traditionally, vaccines have contained either a killed version of the virus or fragments of it, but they need to be made in manufacturing facilities with tight biosecurity. The Pfizer vaccine contains short segments of RNA, the genetic instruction to make part of the spike protein, which coats the outside of the virus. Once injected, the RNA turns muscle cells into spike protein factories, triggering an immune system memory in case the real virus is encountered in future. The challenge now is to distribute 40 million doses that the UK has bought to those who need it the most.
The deployment of the vaccine will involve
This is Matt Hancock speaking about it.
days and weekends, and it comes on top of all the NHS has already done for us this year. I know that they will rise to this challenge of being ready when the science comes good to inject hope into millions of arms this winter.
GPs could staff large vaccination centres 7 days a week to protect people as fast as possible, but the vaccine is unlike anything they're used to.
It'll need to be unfrozen, it'll need to be diluted, and it'll need to be drawn up into separate syringes and then administered. So there are a number of steps which general practice doesn't traditionally have to carry out when it gives a large-scale vaccination programme, but they're not insurmountable.
The UK has enough of the vaccine for 20 million people, short of the 30 million that the government immunisation experts consider to be at risk of serious disease. But it is a start, and if it's approved by safety regulators, rollout will begin immediately in the most extraordinary logistical challenge. Thomas Moore, Sky News.
Tests have shown that the Pfizer-BioNTech vaccine is 90% effective against COVID-19. But before it's made available to the public, it must clear safety and regulatory hurdles. The United States, for example, requires 2 months of data. The Oxford University and AstraZeneca's vaccine is in stage 3 trials and should report within weeks. Trials for Johnson & Johnson's vaccine were paused last month while a possible adverse reaction was investigated. Or further behind, the Sanofi GSK vaccine. First results of a mid-stage study are expected in December. And 10,000 people here in the UK are currently taking part in final phase 3 trials for Novavax. The clear front-runner, though, now is the Pfizer vaccine, created by a German firm founded by a pair of married scientists. From there, they're based in Mainz in Germany, and from where our Europe correspondent Michelle Clifford reports.
It's a tiny company compared to the American giant it collaborated with, but it was here that the COVID-19 vaccine technology was pioneered. The husband and wife team the driving forces behind Germany's BioNTech. CEO Professor Ugo Sahin tasking the workforce back in January to focus on a virus yet to worry Europe.
That's a characteristic of my colleague. He scientifically is a visionary. He can see the way things are going. sometimes before other people can. And in this case, he absolutely did that.
Professor Owen and his wife, Dr. Özlem Türeci, founded BioNTech together in 2008 to develop cancer medicine, before turning their attention this year to a huge project to tackle COVID, the virus related to 1.25 million deaths worldwide. The project was called Lightspeed, an appropriate title given the rapid progress of the vaccine technology, and it was a round-the-clock operation for months, employees working in shifts so the science could continue 24 hours a day. Professor Matthias Theobald knows the couple well and worked with Ugo Sahin for 20 years in cancer medicine. He said the couple's newfound fame will not go to their heads. They're in it for the science.
I think they are, of course, proud. They are celebrities in a scientific way. It's still a sentiment where they feel very humble, you know, they always have been.
But the couple are now amongst Germany's 100 richest people. BioNTech's value soaring to £16 billion since news of the vaccine's results in tests so far broke. And in the small German city of Mainz, where the company is based, there is immense delight in the achievement.
We're feeling very proud and happy that we have a company that produced the vaccine. Thank you.
And now we have like the opportunities to like spread the news that we found the vaccine in Mainz. Of course, it's such as a proud moment for us.
There's hope, yeah, that there will be some medication about that. So I think we all are very happy about this.
There is still a way to go with full development of the vaccine, but this corner of Germany is leading the way. And for the couple being called the brains behind the progress, those long working hours will continue. Michelle Clifford, Sky News, Mainz, Germany.
Wow.
Trials for Johnson & Johnson's vaccine were paused last month while a possible adverse reaction was investigated. Now let's just bring you actually more on our COVID story here.
532 deaths, new deaths, UK.
There we go, just to bring you back here to the UK, and 532 more people were confirmed to have died within 28 days of testing positive for coronavirus, bringing the total number of deaths to 49,770.
Better pause that.
Further 20,000.
Better pause them deaths because I need to know what they are. But this is another short video. Hope you all enjoyed it. Give it a like and give it a comment and share it with your friends. And I'll catch you guys and girls in the next one. Jeremy, peace.